Nice to meet you. What's your name?
My name's Kylan D. Hart.
Kylan D. Hart. Okay, I'm just going to wash my hands real quick before we begin.
Okay.
So, Kylan, have you ever had a nutrition focused exam before?
I have not.
This is your first time. Okay, well, I'll explain a little bit about it, and I'm going to just tell you step by step what I do so you know what to expect and what's going on, okay?
Okay.
So right now I'm just going to go ahead and apply gloves, and I did just wash my hands, so you know everything is sterile. Okay. So, as I said, my name is Victoria D. Hart, and I'm a student at the University of Alabama in the graduate program, and I'm looking to become an RD. And today I'm the one who's going to be performing the nutrition focused physical exam. Kelly, do you know what a nutrition focused physical exam is?
I do not.
You don't? Okay. Well, a nutrition focused physical exam is where I will look at nutrients. I will look at subcutaneous fat loss and muscle wasting, and I will determine your overall nutrition status. Of course, there's other things that need to go in to make a true diagnosis, but these are just things we can look at to see what we're dealing with, okay?
Okay.
I'm going to tell you what you can expect, and that you do have a right to refuse this exam, and I'm going to tell you the risks so you can decide, so I need to have your full consent for that. So what you can expect is for me to observe you in the different places and just note some different things down, okay?
Right.
As far as the risk, there are no risks involved because it will just be observation based, okay?
Okay.
So do I have your consent?
You have my consent.
Okay. So first I'm going to start with your micro and macro deficiencies, and then I'm just going to move down the list, okay? But I will tell you everything I'm doing before I do it.
Alright.
Okay? So first we're going to start with your hair, so I'm just going to feel your hair, okay? Okay. No dryness that I noted within your hair. Now I'm just going to feel your temporal region, so if I could, I'm just going to ask you to act like you're chewing something, and I'm just going to feel, okay? Okay, I'm just checking to see if you have a muscle there, and you do, okay?
Okay.
So now I'm going to feel under your eyes for the fat pads under your eyes, okay?
Okay.
So, okay, that all feels good. Okay, do you ever notice any impaired night vision, blurriness, or dark spots?
No.
Okay. Now I'm just gonna, if you could just look at me, I'm just trying to see if you have any dryness under your eyes or any redness. Do you ever notice any of those things?
No.
Okay, and your face doesn't seem pale to me, so that's good. Now I'm gonna look at your lips, okay? So I'm gonna move to your lips and mouth area because this could tell us a lot about things, okay? Do you ever notice any sores or anything around your lips?
No.
Any burning of the lips?
No.
Okay. So now I'm going to look at your tongue, if that's okay.
Mm-hmm.
So if you could just open your mouth. Okay, so I was looking for glossitis with your tongue. It seems to be good. There also is no paleness of your tongue. When we have a really pale tongue, it means dehydration.
Okay.
So that all looks good. Do you ever notice any burning or sores on your tongue?
No.
Okay. Now I'm gonna look at your gums. If you could, I'm just gonna look at your gums and teeth too. Okay, so I'm just listening for any eroded enamel or dark spot. And so I don't see any of that, so that looks good, okay? As far as your gums, do you ever notice any bleeding gums or gingivitis, as we call it?
No.
Okay. Now I'm gonna move to your neck. I'm just gonna check, do you know what a thyroid is?
Yes.
Okay, so I'm just gonna check your thyroid in your neck. Okay, that seems to be good. Alright, now moving on, I'm just going to look at your skin and ask you a few questions, okay?
Okay.
So, do you have any wounds that are prolonged in healing?
No.
Any itchiness?
No.
Okay, any sun damaged spots that are also not really healing well or continue to be dry?
No.
Okay. Any, what we call it is goose flesh. It's kind of like chill bumps on the back of your arm that don't really go away, so I'm just going to feel for that. Do you ever notice any of that?
I don't think so.
Okay, I don't see any of that. Can I take a look at your palms? So no yellow, just in the palm. Okay, I'm gonna look at your nails now. Nails can tell us a lot about different things, okay? So I guess you have nail polish on right now?
Yes.
Okay. Okay. So when this is off of your nails, do you notice any ridges or any brittleness of your nails?
No.
Okay. Now we're going to move on. Do you have any loss of appetite that you ever notice?
No.
Okay. Now we're going to move on to your muscular system. So do you notice any weakness in any areas?
This arm.
Okay. Did you break it or anything?
Yes, I broke in 2 spots this year.
Okay.
2 years ago.
Okay. Okay. So now I'm just going to check a couple different areas, so I'll have you do a couple of things for me. The first is, can you flex your arm for me? And I'm just going to roll between your elbow and your armpit, okay, just to see the fat there. We always want to make sure we have fat right there, right? So, now if you could just stand up, and just to warn you, I'm going to pinch your sides, okay? Just to see the fat that we have in this region. Okay, now if you could turn around, if you could press against the wall. Okay, I'm just going to feel your back and feel your rib area, okay?
Okay.
Okay, we never want our shoulder blades or the back of our ribs or anything to be too prominent. Okay, good job. You can go ahead and have a seat again. Okay, I'm just going to feel now through your clavicle area and your shoulders, okay?
Okay.
Okay, that feels good. Okay, now I'm going to check your lower extremity, so if you could just put your foot up on the table. Okay, I'm going to feel your thigh muscle, okay?
Okay.
Okay, could you do this leg for me? Okay, now if you could just put your ankle in my hand, and if you could just flex put your toe back and forth. Okay, I'm just feeling your calf muscle right now. Okay? Okay. Now, I'm going to, do you ever notice any muscle cramps or muscle weakness besides that of your arm?
No.
Okay. Now if you could just put your fingers in an OK sign, and I'm just going to check the muscle that you have right here, okay? All right. Now, I'm going to check for, do you know what edema is?
No, I do not.
Okay, edema is fluid retention within the skin, so we always like to check for that. So if I press into your ankle and it stays, then that means you have edema. If it comes right back up, you don't. Okay, so I'm just going to press your ankle. Okay, now I'm going to check for dehydration. As far as the other signs of dehydration, you don't have any of those, but I'm just going to pinch the top of your hand, and if it stays, that means dehydration. Okay?
Okay.
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 All right, do you have any problem concentrating or any memory issues or depression?
No.
Okay. So, Kylan, as far as I can tell, everything looks good. There's no, clinical manifestations or signs of any malnutrition or muscle wasting or subcutaneous fat loss or any nutrition deficiencies that I notice, okay?
Okay.
So overall, your health looks good to me from just this nutrition physical exam. There's not things that I can specifically diagnose from this. You would need a recall of your diet and a more in-depth look at laboratory values and stuff like that.
Okay.
But as far as everything we did today, everything looks great. It was very nice to meet you.
Thanks, Doc.